Hello, Pip. Thanks for joining us. Why is training for online therapy so important?
Well, thank you for inviting me. Online therapy training is crucial, and it's because it's very different from face-to-face work. People assume it's just a matter of turning on Zoom and keeping going as you would face-to-face, but that's not the case. And I think one of the distinctions I want to make is something that I started to consider when I wrote my chapter on online supervision in Anne Stokes's book, and that is the distinction here between therapy delivered online as opposed to online therapy. And that's like supervision delivered online, which is not a specialist training, and online supervision, which is. So here we have therapy delivered online, which is what happened in the pandemic, if you like, as an emergency cover with little or no training. But online therapy, which is the focus of what we're talking about today, is a very specialist training and requires a huge amount of thought before setting out on it. So many therapists just turn on Zoom and do the same thing as face-to-face, when actually what you really need to do is to go back to your modality, the way you trained, strip everything out that's extraneous and work out what the essential components are, and transform that for the online setting. It's such a rewarding exercise to do that and will be very enriching for the client. Sometimes modalities work better online than face-to-face. I've got that. Some examples of some Gestalt exercises and some CBT exercises, for example. But that's what you'll find out if you come and train with us.
Okay, and could you actually, in fact, that's really useful, Pip, but can you tell me about some of the other benefits of training?
Well, I think primarily we're always concerned about the client. The client is why we work. And I believe that when you are trained to work online, the client will be much better supported. Our students, for example, learn how to create that open window between the therapist and the client, no matter what the format, ensuring that the digital aspects of the work we do become seamless and invisible. I'll take the example of a coffee table. When you go to have coffee with someone in a bar and the table is all wonky, instead of having that seamless discussion with your friend, all you're doing is all of you looking at the table leg, trying to get it so that the table is steady. And that completely destroys that flow of conversation. It's the same idea when you haven't got the digital things sorted out properly, it disrupts the therapeutic encounter. So we're aiming to get everything as perfect as we can for that therapeutic encounter, so that the client relationship can develop and nobody has to think about digital things. Another item that would be hugely important and a benefit of the training would be to learn about the assessment and management of risk. And this is something we cover in depth, along with working internationally and some of the other laws. Just a little aside would be, for example, distance selling regulations. No face-to-face therapist has ever had to think about that. So that would be just a few of the benefits, but there are many, many more.
Okay, thank you. And the BACP has published their OTP Competency Framework. How are they relevant to the profession?
Well, let's just be clear that the British Association for Counselling and Psychotherapy has produced excellent paperwork this year. It's a brand new document. It'll be in the resources on the online phone and therapy competence framework. And the thing that and ACTO, also have an online framework as well. And we use both of these to underpin our teaching. But the thing that I particularly appreciate with the BACP one, which has only recently come out, is that it, on the headline page on the BACP site, the strapline under the title is Raising Training and Standards. I don't think this can be a clearer message to those wanting to work online that they need to have training. And a glance at the title pages within that framework will show you that how detailed that training is. You know, this is not a 10-hour course. It'll be more than 100 hours. ACTO requires a minimum of 100 hours to train a therapist as an online therapist. It's so important. And this particular competence framework, the BACP one, was put together by a group of online practitioners with years of experience, both as practitioners and trainers. These competence frameworks are really important because they acknowledge that there are knowledge, skills, and abilities specific to online. And I would urge all of you to take that very seriously, that training is not optional, and that many therapists working online are doing so outside their limit of competence and don't even realize this, which is why we're launching our next 6 months series of free talks entitled "How Can the Academy Help You to Develop as a competent online therapist? You don't know what you don't know." The BACP ethical framework, in its section 13 on working to professional standards, summarizes in its paragraph 14 that we must be competent to deliver the services being offered to at least fundamental professional standards or better. And in my book, that includes digital, which is the thing that most therapists find the most difficult.